Welcome to the Living Healthy with COPD YouTube channel. Subscribe to get daily videos. Also hit the notification bell, and if you like the video, hit the like button. We make videos all about what it is like to live with COPD. The topics range from supplements, diet, exercise, spirituality, medications, and overall healthy lifestyle. Enjoy. Medical devices for managing COPD. Inhalers. When you were diagnosed with COPD, your doctor probably sent you home with some prescription medications to help you manage your symptoms. That means you've got at least 2 types of inhalers in your medicine cabinet, one for daily maintenance meds and another rescue inhaler for symptom flare-ups, says Dr. Elliot Y. Ho, MD, an interventional pulmonologist and critical care physician at Loma Linda University Health in Loma Linda, California. Inhaled bronchodilators, for example, work to open airways for easier breathing as needed or long-term, while corticosteroids are used to fight airway inflammation. Nebulizers. Nebulizers are machines that convert liquid medicine into a mist either by a jet of gas or ultrasonic waves. The drug particles are contained in tiny aerosol droplets inside this mist, which you can then inhale through a mouthpiece or mask. For people with COPD who find it difficult to take their meds via inhaler, Dr. Ho says, a nebulizer can be an easier option for them. A nebulizer gets the medication deep into the lungs where it's needed most, according to the American Lung Association, which also offers handy how-to tips for using these tools. After all, medications work best when you take them properly. Supplemental oxygen. If your blood oxygen levels are low, getting extra oxygen on board can help you breathe better and keep you functioning. If your doctor thinks you could benefit from supplemental oxygen, a variety of devices are available. They consist of either a tank or concentrator attached to a thin hose with a nasal cannula, lightweight tube with hollow prongs that fit inside your nostrils, at the other end for delivering the O2 to your body. Alternatively, your doctor may prescribe a face mask if you need a higher oxygen concentration, extra humidity, or have trouble with the cannula. CPAP or BiPAP. Often used to treat sleep apnea, continuous positive airway pressure, CPAP, and bi-level positive airway pressure, BiPAP, machines use pressure to open airways for better breathing. For my COPD patients who are at the level where they need a device, I usually recommend a CPAP or BiPAP, says Dr. Ho. In both, a mask is applied over the face, and pressures are supplied to assure airways stay open. The lesser used BiPAP has 2 different pressures to help patients ventilate, says Dr. Ho, and is helpful for COPD patients whose blood tests during an exacerbation show high levels of carbon dioxide.